Health experts say major progress has been made in improving the performance of the health sector in the past decade. Notwithstanding this progress, the current health and social care delivery system has failed to keep pace with the needs of an aging population, the changing burden of disease, and rising patient and public expectations. Grenada, through the Ministry of Health, has sought the assistance of Dr. Gail Tomlin Murphy to develop an action plan on the way forward. She says a new approach is needed.
The way that we've been delivering care in the past needs to change. We need to think about in Grenada to deliver care to people where they are in teams. So teams of providers, physicians working with nurses, working with pharmacists, working with social workers and others. The commitment of the Ministry of Health is really clear to me, as well as many stakeholders who I've had the opportunity to meet with over the last couple of days. So our role is to help to develop an implementation plan and to work with the stakeholders, and then an evaluation type of plan to know if they're moving in the direction that they need.
A number of discussions have been held on the improvement of healthcare over the years. Acting Permanent Secretary in the Ministry of Health, Pauline Peters, says the national plan would not be just another document for the shelves.
You would not be able to see changes overnight because it is an entire process. So what we intend to do is look at what are the needs of the population. There are so many emerging diseases. We had chikungunya, we had Zika, yellow fever is looming on the horizon. We are looking at what are the emerging needs, what are the current needs, what are the demands that are being made on the health sector by the public, and to be able to plan for it. So having gathered that information, we will now look at, and then remember we work within certain constraints and policies that the government may have laid down. So how do we align the needs of the public with respect to the policies of the government to be able to find a balance?
Dr. Murphy says she is due to return in November for validation, which will lead to a deliverable in November. Eugenia Peters, GBN News.